Hello, it's me, Noelle-Christine. Let's talk. On October 11th, I went to the emergency room. I had doubled over in pain in my right abdomen area. I'll be honest and say that I thought the worst case scenario, they might take my gallbladder out. I feared they'd run some tests and say I was having another pancreatic attack or gallbladder attack. Something usual. They started off by drawing some blood, doing a urine analysis, and scheduling a CT scan. A bit after the CT scan, the doctor came into the room. He closed the door and sat down and said the word that nobody expects to hear. We need to talk. They found spots on my liver. They thought around 7 masses. The next step was going to be an MRI and admitting me to the hospital. The doctor told us that they couldn't rule out cancer at that time. I was admitted to the hospital on October 12th around 4 a.m. They had planned to do a liver biopsy, and I had waited all day without eating. They finally got the biopsy on October 13th, and I was able to come home 4 hours after. I saw my primary doctor a week later and got some good news. It's not cancer. We went on November the 9th to Indy to meet with Dr. Craig Lammert. I have 11 masses, benign tumors on my liver. These masses are called hepatic adenoma. Since I have over 10 of them, mine are actually referred to as hepatic adenomatosis. The biggest concern with them is when they get to a size greater than 5 centimeters. Hepatic adenomas are primarily seen in females who have a history of oral contraceptive, otherwise known as birth control pills. They have said that I probably have had these for a while because of what is called the metabolic syndrome. This is when you have PCOS, which is polycystic ovarian syndrome, diabetes, and are overweight. The combination causes the metabolic syndrome. Then, with the long-term use of the oral contraceptives, it created a perfect playground for the adenomas to grow. We went on December 2nd to Indy to meet with Dr. Michael House. If anything good came out of all this, it's the fact that I can now tell people that my doctor is Dr. House. That's pretty awesome if you ask me. I have to have surgery. I have no other options. I won't lie in saying that this scares the crap out of me. Dr. House explained that the pain that sent me to the ER was one of the adenomas had bled into itself. This is normal, but it does pose risk. The biggest risk is that they can rupture, and I can bleed internally without knowing it. Here we have the sketch of my liver, drawn by Dr. House. You will notice that he drew where each of the adenomas are located at, with the biggest one there at the bottom. It is coming out of my liver, so that is the one of biggest concern at the time. This is my version of my liver that I created because I thought a clip arty liver with adenomas hanging off of it, why not? It cutifies it, if that makes sense. No real reason to do it other than just I have it for reference. The doctor will remove 30% to 35% of my liver. He is also going to be removing my gallbladder along with it. He did tell us that if he doesn't remove the gallbladder within a year or two, it would be full of gallstones because of all this. So he is going to go ahead and take that out at the same time. Surgery isn't scheduled yet, but Dr. House is thinking it'll be sometime in January. The surgery will take place at University Hospital in Indianapolis. He is thinking around 3 or more days in the hospital before coming home. I will be extremely sore and in pain for a while after surgery, and it could be around 6 to 8 months before I'm feeling back to normal. Dr. House is the best in his field. He is the chief in the Division of Surgical Oncology at University Hospital. Together with Dr. Lammert, he has worked on a research paper that talks about the hepatic adenomas. I am in the best hands possible for this surgery, I feel. I went to the ER thinking it was a gallbladder or pancreatic attack, but it was so much more. I almost came home because I was so tired of waiting in pain, and I really almost never went. The good Lord is what sent me there and kept me there. He has a plan. He always does.